I'm Jerry Hesch, an orthopedic manual physical therapist who treats joints, and I specialize in treating the sacroiliac joint, and have developed these tests, started developing these in 1981. And this presentation is on spring tests I've developed on the sacrum. The sacrum should have mobility inferiorly. We should be able to glide it inferiorly, and some of that movement happens in the SI joint, but some of that also happens in the facet joint where the L5 vertebrae connects to the sacrum. And you should also have backward bending motion, so I also come on the bottom of the sacrum and I spring it inferiorly. Okay? This is the PSISs of the ilium, and so that denotes the transverse axis of rotation at the middle of the SI joint. And so if you spring above that at S1, then you're testing forward bending of the sacrum. And so that's another spring test. You can also spring underneath this flat part of the sacrum called the infralateral angle, or the ILA. And so you put the heel of your hand underneath it, and then you spring up towards the ear, and you do that on each side. Okay? And then looking for this rare left or right rotation, pure rotation of the sacrum, you want to capture S1, S2, and S3. So you find the PSIS, put your thumb there, and the heel of your hand just walks onto the sacrum, and then you spring downward, taking up the slack, spring it. You should feel a forward spring and a recoil, and that's normal mobility. And then you simply walk over to the other side of the sacrum, making sure you're inside the ilium, not on the ilium, and you do the same downward test to evaluate rotation. Now, torsion of the sacrum is an interesting phenomenon that is a twist with a side bending component, and the torsion happens on an oblique axis. It's a complex movement. I wrote a book chapter on that. You can find that on my website, and the website is heschinstitute.com. spelled H-E-S like Sam, C-H, institute.com. Go to the search function and type in sacral torsion. Now, sacral torsions get worse in flexion. So when the person is sitting, they put their lumbar spine in flexion. I have them forward bend a little bit. And then I do a forward spring, and I can do it with my thumb, and I do it on each quadrant of the sacrum. So if you draw a line across the PSISs, that divides it into an upper and lower half, and then you draw a vertical line, and then you have a right lower quadrant, left lower quadrant, upper quadrant on the right, and upper quadrant on the left. And so you can use the heel of the hand on the sacrum, or you can use the thumb, and you just spring it forward. And when there is a torsion of the sacrum, you will find that one portion of it is prominent and it will not spring. And I find these spring tests much more reliable than the tests where people palpate the sacrum and the PSIS and have the person bend the spine or lift one leg up. Those are gross movement tests, whereas the spring testing is much more precise at isolating the joint. And I don't like to go by appearance and just look at the sacrum and say, oh, you have a torsion, because it looks like you have a torsion. And the reason I don't like that is because the multifidi muscles and the erector spinae come down, and the tendons and muscle is overlying the sacrum, and they have innervations that divides them into sections. You know, if you think of a six-pack of the abdomen, where the abdominal wall is separated into segments, the same way those muscles over the sacrum are segmented, so you can have increased muscle tone on one side, and that would be a muscle-nerve interaction as opposed to a twist of the sacrum within the pelvis. The spring tests are better at isolating the latter of that. So the spring tests are very important tests for looking at movement dysfunction of the sacrum as it moves with L5 and as it moves within the ilia in the sacroiliac joint. I hope this is helpful. Thank you.